Hi, as a nurse and as somebody with multiple sclerosis, I want to talk about something and we don't really probably even think about or maybe even out openly discuss, and that's being off your medications. So, I am currently off my medications. No, I didn't just give up. I have my reasons, which I will discuss. But today, let's talk about the possibility of going off your medications, if it's a right choice or wrong choice for you, and explain what some people may not understand about doing so. Stay tuned. Hello, hi, how is everybody out there in the open space land of the YouTube world, whatever. Anyhow, all right. Those of you that don't know me, my name's Erin. I'm a registered nurse. I also have multiple sclerosis, and my plight, of course, is to help those cope with the new MS diagnosis. So I want to definitely, first of all, I'm gonna tell you right now, I'm going to be using paper. I don't care. Hey, newscasters do it. Well, they used to. Now I think they use computers. But anyhow, I'm going to be using paper just to help guide me along with some points that I'm going to talk about. And I want to give a major disclaimer because this one's kind of a little sensitive subject. I am a nurse. I am not your physician. For what I'm about to talk about, you need to discuss everything with your physician, first and foremost. He's your go-to. So do not, and again, don't come at me. I put my disclaimer. This is strictly, for the most part, entertainment, little education, insight. I'm not telling you to go off your medications at all. Don't come at me. Don't come at me, bro. Don't tase me, bro. Yeah, don't take this with a grain of salt. I want you to consider it, think about it, but still discuss with your physician. Okay, I'm not gonna blather on too much. So, okay, we're gonna just start right off. Why people go off their medications. And I won't obviously drag it on with my situation. So, a couple points. Some people, side effects outweigh the benefits. That's the first point. Totally valid, and in a roundabout way, this is one of the reasons why I am off. I'm gonna probably I'll fall into some of these categories. I think I may have explained in other videos. I've been struggling with upper respiratory infection for quite some time. I've had 2 sinus surgeries, which is quite common with the medications as a side effect that I've been doing. The main 2 that I'm used to are Rituxan. I have done one bout of Ocrevus, which is basically the same thing. And then I've most recently been on Kesimpta. It has helped my symptoms in terms of I haven't had any numbness or tingling. However, the biggest side effect I've been experiencing has been just nonstop, like, gross looking snot. I sound super attractive, let me tell you, when I'm hawking up snot balls and all that fun stuff. Sorry about my cat. It's not pretty. So I'm done. I don't want any more sinus surgeries. I'm tired of dealing with all of this constant infection. I want to find something else and hope that this resolves in time. So nothing against my ENT docs. Love you guys all that I've ever worked with, but I hope never to see you again. So with that said, the next point, which I'm kind of disease stability over time. This I think might slightly go along with, I know when my really crappy video about celebrities in MS, and I mentioned that Jack Osborne, who has multiple sclerosis, he has not been doing any medications. And there's a lot of MS patients that do so. They opt not to. Terry Walls, I think, is another one. Dr. Terry Walls, Walls Protocol, another perfect example of not opting to not go with any medications. Instead, they just live a very healthy lifestyle, make sure that they're on top of their diet, eating clean, eating low inflammatory, things like that. So that one's kind of a tricky one. As a nurse, honestly, I'm also kind of thinking of it, well, I don't know. It's kind of like doing the rhythm method in contraception in a way, but yeah, okay. Anyway, that's the next point. Okay, third one, lack of access and or insurance issues. Wah, wah. I have no insurance right now. The medication, as we all know, is super expensive, and they just flat out it can't be done. There is no way you or I can afford, on average, anywhere from $8,000 to $15,000 a month to pay for our medications, depending on what you're on. And that's just a rough estimate, but it's reality. So yeah, I'm holding off also for that reason, because I have to. I can't pay for it until I obtain some employment with benefits. And it's okay. It's fine with me right now. It kind of, like I said, bleeds back into the side effects. So for me right now, no harm, no foul. I'll get there and we'll figure it out. So it happens. Insurance will come. Here's another one you may not have known. Pregnancy and/or family planning. So I would say probably that I know of off the top of my head, 95% of MS medications are highly dangerous to a woman who's pregnant. So ultimately, I know when you are planning to have a child, you have to kind of work your meds around that. And, I think in general, they want like a 3-month. So let's say you try to have children, you're trying to have children, they would want you off your medication, I think, for at least 3 months. Don't quote me on that. That's just kind of a guesstimate, but I seem to remember something like that I was told at one point. I'm no longer on that. I'm out of that. I'm off that boat. But I think they roughly want a 3-month window so that, there's no harm to the baby. They're mostly higher classification of drugs. I know the one that is in the safe that I think it's a C-class drug. Sorry, I'm rusty on my classifications, but I'm pretty sure it's Copaxone. I know that's one that's safe you can use while you're pregnant. That said, I have heard there, which I assume they'd have to be doing more research on, and I may have mentioned again in another video, there is something weird that goes on with the hormonal body of a woman that we do beautifully while we're pregnant, and if we have MS, that we wouldn't need meds anyway. So find that interesting. Wish we knew. I liked it. I'll see if I can find out more about that. The last one, mental health burnout. I can only assume that this would be if you're super, super stressed. You are overwhelmed by everything, which I totally understand this. You're overwhelmed by everything that's going on in the disease process. You're overwhelmed by what would be the best course of action to take. And you might just say, all right, screw it. I just want to just step away and breathe for a second. Totally valid. That's fine too. And in that instance, I would probably go back to the point before where I said disease stability. Just then make sure that you're controlling your diet really well. You're living as clean and healthy of a lifestyle as you possibly can. And that, for the most part, would take care of things. However, unfortunately, stress is always a factor, and we just can't, unfortunately, control stress all the time. We can do our very best. Stress happens, though. Hell, I'll even mention I've been going through some things. I'm doing my best to stay on top of the waves, but we're all human, right? Okay. So moving on. The third thing I want to talk about is the emotional part of being off your medications. So there's probably things that come into this. There's first, of course, and foremost, is a fear of relapse. Not saying, obviously, that it couldn't happen. I think, again, I am not the end-all be-all, just the nurse here. In terms of RRMS, and mine, I'm speaking anecdotally for myself, I feel like I'm in a pretty good place. I don't feel like I feel like my body's manifesting inflammation in other ways right now. So to put an MS flare on top of it would be, just at this point, I'm like, I give up on, in general. But I feel like I'm in a good place. I don't personally feel in fear of any relapse right now. And if I do, I figure, well, okay, then I can easily get some steroids. The good news is steroids is cheap. Is it a rotten medication? Yeah, sure. It has its drawbacks and side effects. You get that puffiness, that bloating, all the other things that come with it. Nobody likes it. But at least in terms of a flare, it'll treat it. It'll at least help things to a certain degree. The next thing is guilt or shame. And I think as a nurse, what I'm going to tell you is, I'm sorry, nothing against your physician, even though I told you to listen, but don't no one should make you feel bad about what your choices are. It's just reality. You know, you're doing what's best for you. That doesn't mean that this is a definite decision. You will listen to what your body tells you and make further decisions accordingly, right? Okay. So don't think that this is the end all be all. Don't let anybody, you know, feel bad. Don't feel bad about it. You're doing what you need to do for you. And it's okay. It's totally okay. It's the same thing as having your lazy days when all you do is lay in bed. It's gonna happen. It's okay. Okay, next one kind of carries in that judgment, and that actually I just touched upon it. Judgment from providers. Again, your choice. And you know, I'll just say it again. It's your body, period. It's up to you. Whatever you want to do, give it some time, think on it, do some research, all the things, and you'll come up on the answer when you need to. That's, I would like to think. And if not, hell, reach out to me. I'd love to help you. Okay, next part. Number 4. What being off MS meds actually looks like. Okay, well, hi, you're looking at it right here. I haven't had my Kesimpta shot in, well, I guess it's been not quite 2 months, looking at 2 months. I feel fine. I feel no different than I did when I had my Kesimpta shot. I've been having some side issues. If I want to be full front honest, I feel like I definitely need to wrangle it in, and this isn't even a New Year's resolution kind of crap because I hate that. It's just been listening to what my body's been doing, and I need to just reel it in. And I've been really good. I haven't really been partaking in any alcohol for a really long time. I'm proud of that. But I just feel like I just haven't been feeling super great. And I just mean like having nothing to do with MS. I just feel like blah. I feel like my diet sucks, and I can tell. I feel like a little bit of, aside from MS symptom of foggy brain, I feel just not quite like as quick-witted as I normally am. So I'm setting a goal that I need to really get on top of my health, and definitely in terms of diet and exercise. So that's something that I will be striving to do as this goes on. But that said, no issues right now. I have no direct MS symptoms, and I'm feeling fine. I just have other things going on. It has, I will say, this is another thing. It brings about some self-awareness. It's going, okay, because when you're first diagnosed with multiple sclerosis, you're thinking, and I did this too, you're thinking everything has to be by the book. I have to do X, Y, and Z, and da-da-da-da-da-da, for the most part. And that's not entirely wrong. However, once you step away, and I think there's a lot of other patients out there would probably agree with me, you start to see, okay, well, multiple sclerosis, there's nothing cut and dried. And I'll take it a step further and tell you that even the little research that I had done, there's no conclusive evidence that being off your medications is completely horrible for you. Again, not telling you to go off. Don't run to your doctor and say, hey, this nurse on YouTube, no, negatory. That's not what I said. I'm just saying there was some research that has said there's nothing conclusive of whether being on or off your medications. Well, obviously being on helps, but being off them is super detrimental. So you just have to, with this, take more responsibility for your health. I think that's the biggest takeaway from this, is not to feel shame. Again, don't let anybody make you feel shameful. Don't totally sit in a corner holding yourself rocking, going, oh my God. You know, if you're like me and you don't have insurance, take a deep breath. It's going to be okay. Just do your best as you can with the low stress, great exercise and good diet, that sort of thing. You'll be okay. And just take it day by day. But I trust you. I assure you that as long as you're on top of things and have some self-awareness, it'll all come out in the wash. That's yeah. Okay, so I guess I have to talk about the fifth point, and that's risks versus reality. I feel like it's still kind of the negative. So, okay, yeah, the risks. Okay, so yeah, like I said, you could have a flare, it could happen. And as I mentioned before, well, the good news is, are MS medications super expensive? Yes, but the good news is, steroids are not. They're relatively affordable. So it's, again, there is a solution to your problem. It also, the risk, again, if you're going to continue living an unhealthy lifestyle, then you run that risk of a flare. So again, reel it in, work on your lifestyle, your health, your diet, exercising. In theory, it should stave it off. This also depends on your MS type. Again, our MS, those of us, those were the majority, in theory, probably should be okay. The more aggressive ones, of course, it's pretty self-explanatory. They're going to likely attack harder, more consistently, more quickly, all the things. So just, of course, as long as you're aware of that with having that form of MS. The other final thing, which I have also mentioned before, the golden number is 65. The age of 65, as I have been made aware by other neurologists, is we don't need medication after the age of 65. And the best that I can kind of figure, which really kind of tracks even if it's not accurate, but our bodies are getting old and they're focused more on just staying alive than they are about then attacking themselves. So that's really what I can kind of surmise. I can figure that's slightly accurate, but I know that not that you won't still be seeing your neurologist, you probably just may not be seeing your neurologist as frequently. So just know that it's not the end of the world, and that's kind of a good thing. Yay, it'd be great to not be on meds forever. So there is a light at the end of the tunnel. Okay, so here are some things. This is probably the most important part. These are the number 6 are things to be aware of when you are going off your medications and things to consider. So the first thing is notify, keep your neurologist in the loop. Make sure that they are aware of what you're doing. I unfortunately have not that my neurologist doesn't know, I've actually kind of got a little sidetracked because I've been dealing with all this sinus surgery and what have you. So I still need to make another an appointment with my neurologist. However, I'm going to keep him in the loop. However, it's still, as I've mentioned before, I'm not appreciating the side effects that I've been experiencing with my past medications. So we're probably going to have to do a little bit of a reset anyway. It is what it is. But of course, I will go see him and let him know. So obviously, keep your doctor informed. Be aware, of course, of your signs of symptoms, your red flags, what have you. Numbness, tingling, for me, vision loss. I mean, obviously, when you're having a flare, you will definitely know when you're having a flare. Just look out for those things. And let's see what else. Shared. Okay, so I'm single. I guess. Well, I hate to say I guess. It is important. If you're married, you have a significant other, keep them informed of what's going on. Perhaps maybe you start to have symptoms and they're like, whoa, what's the deal here? Why are you acting all goofy? Or what's obviously keeping them in your, on the threads, they'll know. So keep your people in your family aware, let them know what the situation is. Maybe they'll be able to help you. That's a possibility too, which wouldn't be, obviously, that would be great. And I'm trying to think when stopping meds would not be a good idea. Well, I mean, the obvious one would be if you're intensely symptomatic at this very point in time. It would be, I think the process would be if you happen to have symptoms in the middle of taking your medications and maybe they're not helping you, but this would go back to your first point of your doctor. Talk to them and then together you can make a better decision of what path to take next. I know there's others that I'm not very, I'll be honest, on the fly, but, and feel free to reach out to me on that too. But ultimately, I think the biggest, most important one would be if you're in the middle of having symptoms in a flare or what have you, obviously you wouldn't go off your meds. You wanna keep yourself as stable as possible. Okay, so as I mentioned, I'm going to just say, communicate, talk to your doctor, talk to your family members, do as best research. I know I said, I wince when I say that research, but I don't want, Google, if it's a .com, I'm gonna say hell to the no. That is not a reliable source. I think I've said that before. So don't go saying Dr. Google. No, that's not Dr. Google. Anything with a .org or an edu, that would be a far more reliable source to consider for going off your medications. But make sure that you're communicating with people, you're communicating with your doctor, and you're doing as best for your body in terms as, good health, which again, I need to follow my own advice. So yeah, please, make sure, just know at the end of the day, you're not alone in this. This happens for a lot of people. You're not broken. You're navigating a really shitty disease. I totally get it. And reach out to me for this if you have any questions. So comment to me if you've had any, questions for your treatment or anything like that. Subscribe to me if you have any major, MS questions, or you'd like to have an honest MS conversation. I'm here for that too. And my final request would be, please share this video with people that anyone that's newly diagnosed with multiple sclerosis, because for them, and myself included, it feels like the end of the world, but it's not. It really is just a little pivot of your life, but it's very doable. So I hope that wasn't too blithering. I've said that before. I feel like it was. But nonetheless, stay tuned for another video. They'll be coming out, and take care. Bye-bye.